Good morning. Is anybody here? Welcome. Thank you for having me. I just came from good old Detroit, and tomorrow I'm going to Lincoln, Nebraska. And then in 2 weeks' time, I go to Edinburgh to give a speech to 600 bankers. Imagine that, a healthcare guy going to tell bankers how they should run their business. Isn't that cool? Anyway, thank you for having me. The talk is about going radical. And what I'm going to do, I'm not going to give you a lot of boring slides, but I'm going to tell you a story which I believe has now proven to deliver extraordinary outcomes in healthcare. And as you might have heard, I am not from healthcare. I came out of the luxury hotel industry. I lived in 10 different countries and worked with the Mandarin Oriental Hotel Group, Peninsula Group, and then ultimately with the Ritz-Carlton Hotel Company. I was the vice president, food and beverage, opened 20 Ritz-Carlton hotels worldwide. And then one day, somebody in healthcare said, would you like to join us and open a brand new hospital for us in Michigan? So imagine how I felt when they came to me to ask me to be the president and a CEO of a hospital with no healthcare experience. Now you can imagine when I was announced, it created a lot of stir in the community, in the healthcare community. And 7 years ago when I started to say, well, how can I be successful in creating a vision which really can revolutionize healthcare? And this is our hospital. Doesn't look like a hospital, does it? It looks more like a Northern Michigan lodge. It looks like a Ritz-Carlton resort. It sits actually on 160 acres of wetlands and woodlands, and it has been now open for 4 years by next month. So when I came on board, the first thing they had to do, they had to surround me with great clinical leaders. So the chief operating officer, chief nursing officer, the chief medical officer. And the first thing we said when we sat around the table, we said, we are not going to open a traditional, typical hospital. We are not going to do what Henry Ford Health System has done over the last 100 years. We are going to challenge the entire industry in order to advance the entire industry through cutting-edge innovation. Now, imagine how that was received by many people in my own organization. A hotelier who never worked in healthcare makes a statement that he's going to challenge the entire industry. Rather arrogant, wouldn't you say? But we felt strong that with a new site, sitting on 160 acres of wetlands and woodlands, having $380 million for us to use, why wouldn't we make that statement? And so we decided to do so. Wait, listen to me. We don't have to be just sheep. This, to me, is one of the most challenging areas in healthcare. We, you, and please forgive me, we have been in an environment where we got stuck. And we let all kinds of regulations, all kinds of traditions, all kinds of established norms, we allow that for us to be stuck. And I feel it is time for us to wake up. And it is time for us to really become radical and to start really questioning what we do today. Is it still relevant for the purpose of one person and one person only, the patient? Which, by the way, in my hospital, I don't call the patient, I call these people guests. They are my guests. They're not just objects who are being poked, who are being treated for an illness, who have to go through an MRI, who have to go through surgical procedures. They are human beings who have emotional needs, and they will be my guests in my hospital. Wait, we don't just want to be sheep. If you don't like change, you're going to like irrelevance even less. This is General Shinseki. I don't know whether you heard about him. He was actually stationed in Iraq, and many years ago he said, we need 300,000 more troops. And the establishment was so upset that they pulled him out of Iraq, sent him to Washington, and gave him a desk job. And then 2 years later, what happened? They sent more troops. So if you, sitting here in this incredible seminar, if you just sit here and next Monday you go back to your operations and you just go and do the same old, shame on you. I'm going to make a very provocative statement here. I don't believe that you know your customers. I don't believe that you really know what your patients want. And what an audacity for me to say that, having never worked in healthcare and only being in healthcare now for 7 years. Well, I tell you, I strongly believe you don't know your patients anymore. You think you do because you have a fancy title, you have been working in the industry for 20 years. How dare you to tell me that I don't know my customer? Well, you don't. And I'm going to substantiate this with a little story from my Ritz-Carlton days. I was a senior officer in the Ritz-Carlton corporate office in Atlanta at that time. And we were it. There was Ritz-Carlton in the 6-star deluxe categories, and then there was something called Four Seasons, and then there was nothing. And so we were it. We had incredible results. You know, the brand Ritz-Carlton was world-renowned. We all walked around in fancy suits, drove fancy European cars, and we were full of ourselves. Very arrogant. We know that we were the best. We knew our customers. One day, ladies and gentlemen, we woke up. We, Ritz-Carlton, were losing market share. How was this possible? We were losing market share, and we were just falling asleep driving our Ritz-Carlton bus. And when we opened our eyes, what did we see? We saw Ritz-Carlton, Four Seasons, Mandarin Oriental, Peninsula, and I can go on and on and on. They all caught up. And so when we finally woke up, we went back to who? Our customers, our guests. And we said, why are you leaving us? And you know what they said? They said, because you're stodgy, you're too British, you're too stiff, you're not family friendly. You have forgotten to listen to us. And here we were, the top of the pops, the creme de la creme. We were it. We had lost touch with our customers. What about you? Have you become as arrogant as we became? Are you walking around and saying, no, you don't understand, Mr. Van Grinsven, with all the complications and the regulations and, this is the way it is? Or are you willing to stop the train and to say, wait, we aren't just sheep. We're going to refocus on who is the most important element in your organization, and in my opinion, it is the patient, it's the family member, it's the communities you operate in, and your employees, your most important assets. But I will get to that later. I love this one too. Doing more of what you're already doing and expecting a different result is a sign of insanity. So this is what is facing us in healthcare. We keep doing the same old, We might maybe be a little bit different in certain areas, but we keep watching what the other is doing, and while we're doing it, cost is increasing, but the value of the customer, for the customer, is not. So here we were 7 years ago with those kind of statements. Very arrogant, very kind of radical in saying we're going to break the mold. We are going to not just do what everybody else is doing. So I read a book. I actually read 2 books which became really crucial. But before I tell you about those books, let me tell you where this hospital is after 4 years of operation. Our customer engagement scores, after 3 months after operation, we were at 99 percentile Press Ganey. Last year, we ended up with 85% top box in likelihood to recommend. So 85% of our customers give us a 5. You know what I told my team? I said that is extraordinary because there are not many hospitals who are having 85% top box in likelihood to recommend. I told my team, extraordinary. But I said, do you know what that means? And they all looked at me, and I said, that means that you are the best of a lousy bunch. And of course, they looked at me and said, okay, who hired this guy? But I said, we need to be at 92% top box in likelihood to recommend. Why? Because then I have Ritz-Carlton force-mark me for my customer engagement scores. Because I strongly feel when you come to a hospital, you are scared, you're worried, you don't know what's going to happen to you, you don't know how it impacts your loved ones, you don't know how it impacts your work. You need more genuine care and comfort than any 6-star deluxe hotel guest. So we are now striving in the next 3 years to get at 92% top box and likelihood to recommend. Oh, and by the way, when I get to 92% top box in likelihood to recommend, how much money do you think I'm going to spend on marketing? Zip, 0. Because those 92% of my people, of my customers, they will go and rave in the communities and they will bring me new customers. Our quality data are remarkably strong. Some of them already benchmarkable in the US. We had 0 infections since the opening, and we have every year we have reduced harm by 12%. Henry Ford Health System is focusing on a harm measurement, which is a combination of many quality measurements combined, and we are well on our way now to become the safest hospital in the United States of America, which has been our goal. Our length of stay is 1.5 days less than our direct competitors at the same acuity level, because we have created a very unique delivery system, which I will allude to you later. Our readmission rates are one of the lowest in the state of Michigan. So even though our length of stay is really down, also our readmission rates are extremely positive. Our operation was 8 months ahead of being cash flow positive. Mind you that we opened in the worst economic times ever in the United States. And that was in 2009 when we opened our facility amidst many competitors with a new hospital we just opened 6 months ahead of us, 5 miles down the road. Last year we became profitable, 1 year ahead of schedule. Our employee engagement, after 2 years, I asked them to compare me with all new to open facility in the United States of America in all service industries. We came out #1 in employee engagement. And the community now is fully embracing it. So our outcomes have been extraordinary. And here is how I believe the ladies and gentlemen in West Bloomfield got to it. And that brings me now back to my two famous books. The first book I read was called Blue Ocean Strategies. Any of you has read that book? Excellent, one person. I highly recommend that you read the book, especially for us in healthcare. It's a book based on research which has observed and studied companies in different service industries, including healthcare. And in that book, what they have come to realization is that many of us are in the red ocean, meaning it's a red ocean where it's throat-cutting competition, where we keep copying each other, where we keep watching each other, and because of that, cost keeps increasing, but the value to the customer does not. And they say if you really want to be successful, you got to put yourself in the blue ocean and become so distinct, so unique, that you make your competitor irrelevant or you bring positive change to your competitor. And there is a beautiful example there. In the circus business in America, there was Ringling Brothers and there was this other one who I cannot pronounce, Barton and Mail or something. And those two were competing head-to-head. One was getting more expensive clowns, one was getting more exotic animals, and while they were competing, throat-cutting competition, cost was increasing, but the value to the customer was not. So one day, a guy walks in and says, I like to be in that business. But you know what? I don't need animals. Upkeep, transportation costs, medical expense, I don't need that. And by the way, I don't need all these expensive clowns. But you know what I will bring? I'll bring a little bit of a show element. And Cirque du Soleil was created. Cirque du Soleil is a beautiful example of what a blue ocean strategy will ultimately lead to. And look today where Cirque du Soleil is. So, 2 weeks on the job, 7 years ago, I sat in my boardroom on a Monday morning at 7 a.m. with all my clinical leaders. And I sat down and I said, team, I have a statement to make. And they said, okay, here it comes. Because first of all, they didn't really accept me yet because they didn't believe that I was the right choice. Secondly, I spoke with that phony accent, which really worried them. But then basically I said, ladies and gentlemen, I want to be the Cirque du Soleil of healthcare. Now, imagine this. Clinical leaders, highly educated, very intelligent, all big eyes. Nobody spoke, and what I could read in their eyes was, CEO gone wild. So I begged them, would you please do me a favor and at least read the book? So they all read the book, and it was a miracle. The Vice President of Clinical Programs, who is also the chair of our neurosurgery division, who is in his 60s, my chief medical officer, my chief nursing officers, they came back and said, Gerard, you're right. We have one chance to break the mold. We have one chance to disrupt what we normally have been doing. We have to be the Cirque du Soleil of healthcare. This was very crucial in our journey. Second book might maybe surprise you. It's called The Power of the Purse. It's a book, ladies and gentlemen, which teaches us how powerful women are when it comes to purchasing power. And surprisingly, two weeks after I read the book, very easy to read book, I heard the author came to downtown Detroit for a lecture. I said, I need to be there. Ladies and gentlemen, the most remarkable and the most memorable evening of my life. 300 women and I. It was unbelievable. I can't remember what the woman talked about. I was rather distracted. But what it ultimately led to is that we did further research. And what did we find out? And I don't know how it's in your country, but 90% of the purchasing power in healthcare is done by women. Women tell their loved ones, their parents, their grandparents, their tennis partners where to go for health care. And so, in addition, what we found out is that women are not satisfied anymore in getting traditional medical care. Women are looking for activities and programs which will help them in their physical and mental well-being. So, Cirque du Soleil, prime customer women, because we knew if we could hook the women, they would bring every other specialty to our hospital. And with that, we said, well, what do we need to do then? So we said, we need to create positioning that we position our facility as a community center for well-being rather than a typical traditional hospital, where foremost we would create great clinical programs, where we would have a safe environment. But why can't we, in addition, become health coaches and health mentors to the communities we operate in? And how can we take that stigma away that a hospital is a scary place where you really do not want to go unless you are seriously ill or you have a loved one there? So with that, we said we need to rethink in how we're going to create this facility. So the cornerstone of the Blue Ocean strategy is how can you increase the buyer value, but by reducing cost. And here you see 4 very simple questions which we started to ask ourselves when we were further defining what that community center for well-being should look like. Simple questions like, which factors should be reduced well below the industry standard? Are there still things you're doing which really have no value anymore, but because of tradition and because of what others have told you, you still continue to keep doing those? Create. Which factors should be created that the industry has never offered? In a minute, I'm going to announce to you how we actually built the Community Center for Wellbeing, and that we actually created new elements which healthcare never delivered before, and is helping us to create a revenue stream, which is helping us therefore to reduce our costs and therefore become highly efficient. Raise. Which factors should be raised well above the industry standard? Well, for me, that was very simple. Service. Because service in healthcare is definitely not where it needs to be. And in our hospital, we have decided that we are going to deliver on the unexpressed wishes and needs of our customers, our guests. Can I ask a question? Who's married in this room or is in a relationship? I always love when I ask that because there are always people who kind of are hesitant to raise their hand. You know, I'm married to a British girl from Liverpool. When I went to England, I said I would never, ever associate myself with an English woman because I thought they were very snooty. But unfortunately, I had nothing to say in the matter. And so here she is. But when I met her, I couldn't believe that that woman was interested in me. And you know what I did? I did all kinds of things to really surprise and delight her. I did things which I can't talk about this morning. But it worked. And so when we met, we had the most amazing relationship. We communicated about things, about religion, about sex, about politics. I mean, till early on in the morning. We had such a great relationship, and we did everything to really, you know, surprise and delight each other. And then we got married. And then all that stuff was really not important anymore because, well, I don't have to tell her that I love her because she knows that, right? I don't have to put that little, you know, piece of paper in a handbag anymore and say, hey, honey, I love you. You know, I don't have to do that anymore because she knows that. And I don't have to talk to her anymore till late in the evening about all kinds of things because she knows that I'm busy and have a career and all that stuff. And then I'm surprised that one day I come home and on the kitchen table there's a little note, "Honey, I have left," which didn't happen, by the way. Thank God. But it could well have happened. But same with us. We take our customers for granted. We are not anymore delivering on the unexpressed wishes and needs of our customers. And I'm challenging the gentlemen in this room this weekend, go and try to deliver on the unexpressed wishes and needs of your partners. See what will happen. You will be pleasantly surprised. So how can we do that for our customers in the hospital that they will be surprised and delighted? Eliminate. Which of the factors that the industry takes for granted should be eliminated? Are there elements you are doing which you really, should get rid of because they don't give any value anymore to the care of your patients? So we use this 4-action framework to decide what is this community center for well-being going to be. So back to Cirque du Soleil and women in mind. So we created a moral compass, which we call the 4 filters, which helped us to decide what was the design, the architecture, and our processes going to look like for this community center for well-being. And the first filter was quality and safety. Everything we do has to be quality-driven, has to be safe. I'm very pleased to tell you that last year, and Henry Ford West Bloomfield Hospital had a lot to do with it, we won the National Malcolm Baldrige Quality Award, which is an incredible accomplishment for the Henry Ford Health System. But what was great in the report, they talked about how West Bloomfield really helped to get us to that award. By the way, I also won that award with Ritz-Carlton twice. So it's a great recognition for the quality work we're doing in this facility. The second filter, compassionate care. Is the design reeking to compassionate care? Are our processes we create for our guests delivering on compassionate care? The third filter, memorable experiences. Is this design helping to create positive, memorable experiences? Are these processes going to lead to a memorable experience for the patient, for the family member, and the community we operate in? And then the fourth filter, efficiency. And I hope you hear me, efficiency is my last filter. So when we make decisions, we look first what's right for quality and safety. Is it driving compassion? Is it driving memorable experiences? And then, can we do it in a way that we're not losing our shirts? Another criticism I have in healthcare is that we are being basically focused too much, and we're being brainwashed to always focus on money, always focus on efficiencies, and then we take shortcuts in quality and safety, we take shortcuts in compassionate care, and we take shortcuts in memorable experiences. And we said if we consistently, passionately deliver on the first 3 filters, we don't have to worry about financials. And here we are. We have shown that we are now delivering great cash flow performance for the Henry Ford Health System. We were profitable 1 year ahead. We have adapted lean, so we're consistently looking for waste, but it's the last filter and not the first filter. So with that, we put the whole design of the hospital through those 4 filters. And we made significant changes. We made such significant changes that we actually proposed to delay the opening of the hospital by 6 months, and I had to go to the board and ask for $40 million more. Took me 7 minutes to get approval. 7 minutes. You know how I did it? Well, I was new in healthcare. I said, you know what, maybe I drug them their coffee, and then they will just agree to whatever I say. And that's what I did. Just a joke. It's not what I did. But the reason they gave me the approval so far is because of the investment we showed that we could improve significantly our cash flow performance. And what did we do with those investments? Well, we made significant changes in the ORs. Some of our ORs were designed where the patient is wheeled in feet first, the other one head first. Well, that's a safety issue right there. So we changed that. Compassionate care. We had those typical small, flimsy ED cubicles. We are in the heart of the Chaldean community. That's the Catholic Iraqis. When one Chaldean comes to the ER, the whole village comes. And so we expanded the size of the the cubicles. We also put sliding doors in so that the patient doesn't have to hear the suffering of the patient next door. Compassionate care. Memorable experiences. Well, that's where we made significant changes. My original design of the entrance of my hospital was a typical hospital entrance. Cold, clinical, intimidating, scary, and it smelled like a hospital. So our hospital, as you saw before, is designed as a Northern Michigan lodge. So I asked the architects and the interior designers to go to Northern Michigan and take pictures of main streets, storefronts, and then I said, blow up the whole main entrance and create an environment when the people walk in, it's warm, it's inviting, it puts them at ease. Wellness communicates to them and not illness. In my opinion, healthcare has moved too much to sick care. We need to bring it back to the word healthcare. It doesn't say sick care, it says healthcare, but we behave like a sick care organization. So then we said, Cirque du Soleil, women, what is the first impression going to be at that main entrance? And by the way, first impressions for me are crucial, because first impressions, ladies and gentlemen, says who you are, what you stand for. It communicates your brand. And that's where in healthcare we often don't put enough value to that first impression. So when you walk in now, in our hospital, you feel as if you're in the Northern Michigan Main Street. There's an open fire there. It's warm. There are people standing there to give you a warm welcome. We have Vita there. Vita is our wellness institute. We have 11 healing rooms with water therapies, where we do massages, where we do alternative medicine. Imagine how that went down with our Henry Ford Medical Group physicians. But what we did, we used the Mayo Clinic book, and they have a book where they have a red, yellow, and green stoplight, where they basically evaluated all the alternative medicine modules, and we made sure that the ones we took, that they were safe. Some might not have evidence, some had some evidence, but the reason we did it was why? Because we listened to the customer. And guess who is the biggest user of alternative medicine? Women. And who am I to tell women, no, you can't have that here in my hospital because we don't believe in it? So with the blessing of the medical group, we basically feature that in there. We have health coaches in there so that women can come before they go to their doctor's appointment and they can get advice on how do I deal with all the stress I'm dealing with my kids running around, with my husband who's traveling, with me having a job. How can I get help in terms of how I should better take care of my body? So right next to the Wellness Institute, we have a 90-seat auditorium with a state-of-the-art kitchen line. Well, why is that important? Because food in a community center for well-being became crucial. Food is healing. Food should be medicine. Today, food is killing us, and today, you and I have Mr. Pizza Man regularly visiting us at home, your freezers are filled with processed food because it's easier, it's quick, 5 minutes microwave, and I can feed my kids. And then we are surprised that we have an epidemic of childhood obesity there. So we said food is going to be very important. So we now do, at the main entrance, a beautiful site, we do cooking classes for people with diabetes, cancer, heart conditions, cooking classes for little children who come and have a lot of fun, you know, teaching how can a carrot actually taste good. So we have cameras. Every cooking class is piped into the patient room. So now the patient can start thinking differently in how they're going to eat when they get discharged. But that's not good enough. Then we created a cafe called Henry's Cafe, where we basically blew up all the deep fryers, all the freezers. Everything is fresh. Everything is made à la minute, nothing out of a pack, and it is predominantly organic. And guess what? Every day I have 200 people in the community come and eat in Henry's Cafe. They have no loved ones there. They have no clinic visit there. They love the environment so much that they want to come there because the food is good, and it's healthy, and it's tasty, and it's reasonably priced, and it takes that stigma away from what a hospital is. But that is not good enough either. 5 months ago, we opened the first hydroponic organic greenhouse in healthcare in the US, and maybe beyond the US. And it's the first hydroponic organic greenhouse in the state of Michigan. It has an education center attached with it. And you might think, well, who's paying for all this? Well, I'm not. I found a great philanthropist who believed in this. The gentleman came in, he saw the vision, he said, tell me what you need, Gerard. And I said, I need a greenhouse with an education center attached. So now every day we have yellow school buses coming. And we are teaching kids in a fun way the value of eating well. And then they go in the display kitchen and they start cooking with it. We are now targeting the elderly in the community. In my community, in the next 5 years, 65 and plus is going to increase by 25%. It's my future customers. So how can I hook them in so that they can learn how to start living a better, productive life? In 3 months, we are going to launch the first culinary learning institute for healthcare in the world. We're going to promote this to hospitals, hotel groups, restaurant groups, universities, to have their chefs coming to us for 1 week. We create for them a toolkit how they can change their food culture in their organization. And guess what I do? I will charge the heck out of them. A new revenue stream. So how can you, in these questions, create which factors should be created that the industry has never offered? Here's an example. So with this, we now have constantly people coming in to learn about cooking. But what does that do for me? It creates opportunities for me to create a relationship with these people. And guess what? When they get ill, they have the guts to tell their private physician, maybe I should go to that hospital because they care about me. They care about my well-being. They are investing in added value. That's where I want to go. And by the way, I know the Henry Ford Medical Group is there, one of the oldest employed physician groups in the country, which is known for its high quality and low cost. But that was not good enough. Community Center for Well-being. Now we do concerts all the time. Ladies and gentlemen, music is healing. So we had 4 concerts with the Detroit Symphony Orchestra, where we really are, you know, where the patients can see it. We have 600-700 people coming to a concert. Community members, physicians, staff, and patients. So it lifts up their spirit. And studies have shown that actually helps them to heal faster when they see that life continues around them. We do every Mother's Day, Father's Day, 6 times a year, we do a jazz concert in our atrium. The patients can see it. 600 people in the community come, many of them who never have been in the hospital. I am there every concert to tell them how unique we are and to tell them about our great outcomes because they are potential new customers for me. So you might think, well, this Ritz-Carlton guy comes up with all these creative ideas, but you know what? It doesn't work. It doesn't make money. Well, you're wrong. It actually has made us very successful. It actually has positioned us uniquely, distinctively versus our competitors. It actually has helped me to steal significant market share away from them. So don't ridicule this. This really works. And I hope that I can entice you to start thinking in my organization, can I maybe adapt some of those things for the benefit to create a distinctive experience blueprint for my customers. But that's not good enough. Guess what happened in my hospital 3 months ago? We had our first wedding. 250 people came for wedding, and there were another patient, a community member, and I, of course, made it the Ritz-Carlton wedding. I lost money on it. They were very happy. But guess what started to happen? There was so much criticism in the beginning, so much fear. The nurses were not too keen on the idea. You know, the physicians were raising their eyebrows. But I felt, Community Center for Wellbeing, why can't we have weddings? And here's when the miracle started to happen. During the event, because the patient rooms look out on this atrium, the patients were asking the nurses, can you push my bed closer to the window? Because it lifted up their spirit to see a beautiful couple getting married. We had on the third and the second balcony, we had patients who could walk looking at the wedding. It lifted up their spirit. I have now 20 wedding inquiries. How cool is that? A community center for well-being. And all these people who come to this wedding, bingo, it allows me to create a relationship with them. So one day when they need clinical help, when they need wellness services, they will be thinking about us and not my competitor. So all these things are not just to create disruption. They are well thought through business practices which ultimately will make us successful. Our patient rooms, ladies and gentlemen, are all private. Why? Because we want to be the Ritz-Carlton of healthcare, so we can charge more money? No. We decided from the get-go that we would have private patient rooms because studies have shown, you know it better than I do, that it significantly reduces infection rates. And by the way, it helps in the healing of our patients because our patients look out on the atrium, which is beautiful with stones and live trees, or they look out on the next 80 acres of wetlands and woodlands, where they can see deer running around, where they see a swan on the lake. And so nature is coming into the building. Private rooms will help the healing, and it shows in my length of stay. We don't do overhead paging. We do not wake up the patient between 11 and 5:30 unless clinically needed. How cool is that, that you can sleep in a hospital? And so what we have done, we put the patient, the guest, in the center of all what we do, and not just us in the center, and then expect that the patient has to adapt and the family has to adapt, and it's working tremendously well for us. All what I just told you cannot be successful unless you put the heart and the soul into the building of who you are. And this brings me now to my employees. This brings me to my physicians. Because if we don't create the right culture where people are treated with trust and respect and dignity, where they're not involved in the decision-making, where they are not empowered, then we will never see the return on investment of this unique vision which I described to you before. And I want you to look at these two circles and imagine now what is happening in how we are radically changing in how we are going to select and how we are going to focus on our workforce. This is the traditional. On the right side, technical skills. The blue one is talent, which is unteachable. And see what starts to happen. instead of putting all the focus on the technical know-how, we decided that we were going to shift to the talent, the unteachable. It is my belief that in healthcare, we hire warm bodies, meaning we look at a resume, which at times is inflated. Then we look at the individual, looks good, dresses well, says the right thing. I hire him. But I hire him really not knowing whether this will work or not. So it's kind of blind hiring. We decided from the get-go that we were becoming a talent-based organization where we first would first look at talent, natural talent. So we bought a company of Nebraska called Talent Plus, which created an evidence-based interview process where you can see, does this nurse have talent for relationships? Does this physician have talent for relationships? Do they have talent for compassionate care? We refused, and I hope that some of the physicians in the room will not shoot me, but we refused 38 physicians because they didn't have talent for relationships. And that became a huge war within our own organization. But we said, this is what we're going to do. So we have hired all our 1,800 people based on talent first. Then we look at the skill set and the experience so we could put them on the right seat on the bus and then unleash them so that they could use their talent to the fullest. So what makes you a highly successful organization, a hospital? It starts with the blue box being a talent-based organization, in really making sure that you hire for talent and then you unleash, you empower your talent to do what they know best. And don't put them in a box and don't create such huge hierarchy that nobody is allowed to make a decision, nobody can think innovatively, nobody can try new ideas out. Let your talents go. And you, as a leader, are there to support, to recognize, to give them the tools so they can do their jobs. But that's something we in healthcare are still not really doing well. We decided to be radical and do that from the get-go, which ultimately led to the green box, which says high-performing culture. Just for your information, when we have orientation in our hospital, a week before, I get a list with all the new employees, and myself, the chief medical officer, the chief operating officer, the chief financial officer, we call 6 employees at home, and we say the following. What is your first name? Andrew. I said, Andrew, hi, it's Gerard van Grinsven. I'm the president of the Ford West Bloomfield. I understand you're going to join our organization, and I want to thank you that you chose to come and work for us and not somebody else. And by the way, Andrew, I'm so much looking forward to see you at our orientation. Have a great day, Andrew. Wow. Guess what he's going to do? He's going to tell his whole family. Guess who just called me? The president of this hospital called me to thank me that I chose to come and work in his organization. So you might maybe think that's a stupid thing. How much time did that cost me to make 6 calls? How much effort did that take me? But the impact is huge. And then when they come, who is there on a red carpet welcoming them? It's me, the chief medical officer, the chief operating officer. So we have created a very unique, high-performing culture, which then leads to the red box, which is a customer advocacy. Because then you create, like I said, the 85% top box, which ultimately will lead to the 92% top box. Then the customers, they don't want to go anywhere else because they feel that they have been treated as a human being with great clinical care, with great patient safety, and that they were emotionally really focused on. And that ultimately creates to sustain excellence. I'm not worried about the future of West Bloomfield. Actually, we're now going to build 2 more pods so we can grow to 300 beds because I'm already running 85% occupancy. And I have another 80 acres, which ultimately will become the #1 health village in the United States of America. So I decided to show you some pictures. Now, who doesn't want to stay here? I mean, isn't this beautiful? We brought nature into the building. This is our main street. There's every day a lot of activities. We have wonderful shops there. We have, by the way, we opened a hair salon. Okay, well, why a hair salon? Well, I was thinking about my staff, and I was thinking about women, because I've been trained to think about women. And women want to have their hair taken care of, whether they're patients, whether they're nurses, whether they're physicians. And by the way, it's a hook to get the community to come in. And guess what we did with our hairstylists? We had them trained by our dermatologists to look for growth. And we actually sent already 55 guests who came for hair treatment to dermatology. 4 were diagnosed. We are saving lives through haircuts. Wow. Here is a picture of our education center right next to the greenhouse. This is where we now do all kinds of classes for the community. We are already producing 40% of our produce for the hospital. And ultimately, next year, we'll go to 90% of the produce will be produced in our own greenhouse. And the Henry Ford Health System has now adapted that and is going to create greenhouses in downtown Detroit, because downtown Detroit needs it most. And so here's a picture of that one. This is Michelle. Michelle is our resident farmer. She ran a farm in Yale, Michigan. She heard about our vision, and one day came to my office and said, "Sir, I'd like to be part of your team." And she basically should get all the credit for the execution of the greenhouse. She loves children, and so she is now going to all the schools and bringing all those school districts to come to our greenhouse. She talks to patients, she talks to family members, so it's really creating an extraordinary experience. Here's another picture of the education center. Here's the outside. This is our Henry's Cafe, where people can sit outside. We do often culinary events. We bring celebrity chefs in to help the community. Here's a way how you can eat healthy, but still have a very healthy environment. Another picture with the hospital on the right side. This is Henry's itself. Another beautiful shot at night. So, what I tried to tell you today, are you prepared to start thinking a little bit more radical? Are you prepared to start saying, we don't just have to be controlled by the establishment. We don't have to be controlled by regulation only. Are there elements in my hospital where I can again put the customer in the center of all what we do? Can we create new added values which really enhances the experience blueprint for my customers, so that I will be enticing them to talk positively about me? How can I create a culture where every single employee, where every single physician feels that they are treated as a customer and that we're trying to deliver on their unexpressed wishes and needs? And when you can combine that culture with some very unique added values, ladies and gentlemen, I think you can really bring some great new directions to your organization and impact your outcomes, impact quality, impact safety. You know, in our culture, because the staff feel very valued, they communicate better. And you know what happens when people communicate better in healthcare. There are less medical errors. There are less malpractice payments. And our malpractice payments are close to zero. Our medical errors, I told you, every year we have seen significant drop because of that culture of open communication. So thank you so much for listening to me, and thank you for having me.